it just came in like a wrecking ball and destroyed my life.
Ashley Antonio didn't think she'd get sick with COVID-19, let alone become a long hauler. But months later, the fatigue, the brain fog, and the shortness of breath still linger.
I think people just need to know that there are a lot of us, and it can happen to you too.
An average of more than 1,700 Albertans now join the ranks of the infected every day. 2 weeks ago, the province rolled out some stricter measures, but the Premier resisted calls for a lockdown, saying he didn't want to infringe on personal freedoms. Since that announcement, Alberta has reported more than 150 deaths from the virus.
If stronger action is not taken now, we know that hundreds or potentially thousands more Albertans could die. We cannot let that happen. We will not let that happen.
Under the new measures, effective immediately, masks are mandatory in public indoor spaces across the province, not just in Calgary and Edmonton. All indoor and outdoor gatherings are banned, and starting Monday, restaurants, casinos, and hair salons will be shut down. Malls and retail businesses can stay open with tighter rules on capacity. In Calgary, some accept the need for more restrictions.
Nobody likes it, but if it's going to yield results and then bring these cases down, then I guess you do what you got to do. But not happy about it, but we're going to do our part.
I just mostly worry about small businesses and those people that would just more directly be affected.
I think it should have happened sooner. I mean, the writing was on the wall after Thanksgiving.
For some doctors and public health experts, the more aggressive measures are overdue.
There's at least tenfold, maybe much more than that, number of active cases in all of our communities right now than there were back in the spring. And so the risk is just measurably that much higher. So I think that the restrictions have to be that much broader.
So Alison, just listening to you, this is a big step in response to a big problem, but what is the plan if the cases keep coming?
Well, Adrienne, as CBC News recently learned, the province has reached out to the federal government and the Canadian Red Cross for help with 4 field hospitals. Now, the Premier says that's just a contingency plan for an extreme scenario. Now, we've also learned that the Canadian military is preparing for a possible deployment of troops in the prairie provinces. A senior defense source says there's been a special focus on calling on reservists in Alberta, Saskatchewan, and Manitoba, just in case there is that call for assistance.
Okay, really good to know. Thank you, Alison Dempster in Calgary tonight.